Hi, I'm Dr. Patrick Retzer. I've had the pleasure of working with Danville Materials to develop a new paradigm in impression taking. All of the products that I've developed have been aimed at making the dentist's day better, therefore making the patient's day better. When we talk about this system, we're going to be talking about three items. Damit. The second device I'm going to show you is a series of retractors that will retract from hamular process to hamular process or retromolar pad to retromolar pad, closing off Stenson's duct temporarily and getting mustache hair and lip tissue out of the way during the impressions. Once the tray is seated, the retractor can be simply removed. The third thing I'm going to be talking about and showing is the occlusal sweep. Using these three together, we've been able to master the impression technique, causing no to very little gag response. Now, interestingly enough, our patient today reports that she did have a gag response. Great, and you mentioned that you use it with alginates?
Yes, we do. We use it with all our materials, our alginate, our wet alginate, our alginate substitute, the monophase, everything that we're using for our final impressions. I find that we are doing a better job with our impression taking because of the Damit material.
The fifth hand comes in four sizes: small or pedo, medium adult, large adult, and extra large adult. Note that the flaps on the ends of the retractor are bent inward to accommodate the plane of the cheeks. These flaps are designed to close off Stenson's duct either by holding dry angles firmly in place or by themselves accomplishing ischemic compression of the salivary gland duct. This will greatly decrease the flow of saliva or eliminate it during the impression. Note the flexible nature of the retractors. They are very kind to the tissues. The retractors are squeezed inward to enter the mouth comfortably. Note the full exposure of both upper and lower arches and ease of placement when trays are tried in or when they're filled. Also note how the retractor comes straight out, whether it's upper or lower tray. Either foam pads or orthodontic wax will soften the contact points on the hard vestibular tissue when these retractors are used in a more aggressive manner. Generally speaking, 3 of these foam strips will accommodate all situations. The patients appreciate the softening of the edges. Damit is a membrane that's dispensed from the self-stripping dispenser. This will strip off the backing. Cutter blade that's on the self-stripping dispenser will cut the membrane at either 1 or 2 repeats of the printed logo on the membrane. 2 repeats will close off the back of a full upper tray, and 1 repeat for each heel will close off the lower tray. The dotted line is aligned with the base of the tray, whether it is an upper or a lower tray. And then vertical cuts with the scissors will allow a neat folding of the membrane, assuring a watertight seal at the open ends of the upper or lower trays. 1 repeat for each end of the lower tray, following the same dotted line alignment principle, will close off the heels of the lower tray. Triple trays can be improved using the membrane to create sides that are sadly lacking on these trays. Using our membrane, we can create a side that will bend very comfortably when it engages tissue, yet will hold the material and resist that lateral flow as it's seated. Tray Link adhesive is a very fast-setting, extremely strong bonding agent for polyvinyl impression materials. 1 thin coat is adequate to apply after the membrane is fitted. Tray Link eliminates the laboratory objection to PVS separation from the tray. This will facilitate repores of any PVS impression material when used appropriately. Occlusal sweeps have a closed tip when they are shipped to the dentist. Scissors are used to cut the leaves free for maximum dispersion on the buccal, lingual, and occlusal surfaces. Note that when these leaves are cut free, they splay both horizontally in the buccal, lingual, and the distal direction. Please do not use light body material in here. With the retractor in place for the upper impression, we're going to demonstrate the occlusal sweep without the gun and the material being used. Note complete retraction of the arch from hamular notch to hamular notch. Notice how the sweep is pulled along the occlusal surfaces, pushing air and moisture ahead of it, guaranteeing perfect buccal, lingual, and occlusal registration. When loading the tray, do not put material in the palate. You will Notice how the retractor is pulled straight forward to remove it from the mouth for a comfortable impression. This shows the incredibly accurate impression that is accomplished using the sweep and the Damit and the retractor. With the lower, after the material is swept on, the tray is seated, retractor is removed in a straightforward manner. Again, notice second and third molar detail on the distals, never missing a margin, always accomplishing the detail that is needed for any type of an aligner appliance or space maintainer appliance or any kind of an occlusal splint. Here we're showing the sweep and the triple tray used in conjunction with the retractor. Notice how the material is swept on past the midline. Then the triple tray with sides that are created by our membrane is inserted. The membrane is supporting the material is supporting the membrane. As the jaws are closed together, you get very little lateral flow of material. A very nice impression.
I think with our patients we see less gagging since we have been using the Damit. Once you get that impression in and that patient starts to gag, you're going to lose it, and they want you to take it out immediately, and it's kind of uncomfortable for the patient and a little uncomfortable for the assistant. I find that once that Damit material's on there, things just run smoother and you have less gagging, so you're not having to chase the patient to get them to sit still in the chair.